Hi, I'm Aswita Tan-McGrory. I'm the Deputy Director at the Disparities Solution Center at Massachusetts General Hospital in Boston, and I'm here to talk to you about the Pediatric Health Equity Collaborative, or PHEC, and the recommendations that this group made on how to collect data in the pediatric setting. So we know that by 2020 in the United States, the pediatric population is projected to be a majority-minority population. So this population is becoming increasingly diverse, and organizations will have to think about how they collect data, especially on the 6 domains that we have here, which I will go through and give you the key recommendation for each domain. For race and ethnicity, what's really important to remember is that make sure that you have a category for multi-ethnic or multiracial, and also make sure that you collect the race and ethnicity from the caregiver. And lastly, you'll have to determine at what point you'll collect this information from the patient themselves. What age would that be? For the caregiver domain, just make sure that you have privacy protocols embedded into your system. And again, you have to think about at what point do you stop asking the questions from the caregiver and ask them from the patient. For the disability domain, you really should think about collecting information on the disability of caregivers, and then also realize that you have to collect this information at multiple points over time. For the social determinants of health data, the Institute of Medicine made a recommendation and report on what different domains you can collect. And so institutions will have to consider the populations that they serve and think about how to tailor this to their population. And think about using technology like an iPad or an electronic home portal on collecting this data, since there might be time constraints in collecting this in the clinical setting. For the language data, if there's only one data element in your electronic medical record, at minimum you should collect the information on the caregiver with limited English proficiency, so collect their preferred spoken language in that data element. For the last domain on sexual orientation and gender identity, it's important to remember that we need to define the purpose of data collection, train staff, ensure privacy, and then also know that this may be changing over time. So be aware that there's a fluidity in the response and collect this data over the course of the patient's lifetime.